Thank you, as always, my friend. So good to see you on this Friday. So the combination of high poverty rates, low access to health care, and rising coronavirus numbers is proving to be a crippling combination in the Appalachian region right now. Rural hospitals there, they're being pushed to capacity. Worse than a shortage of beds is the shortage of doctors and nurses. NBC's Dasha Burns is in Bristol, Tennessee for us. Dasha, good to see you this afternoon. Thanks for joining us on this. It's interesting because having spoken to a lot of healthcare professionals myself across this country, there is this idea that the more cases, the more rising cases, the more likely it is that doctors and nurses will also begin to test positive, and there won't be enough resources at the hospitals to take care of patients. How are folks faring there so far?
Hey, Yasmin, that problem is happening here as it is happening in so many places across the country. Right now, I'm at one of the hospitals for Ballad Health Systems. They are the only hospital provider in this part of Appalachia, covering 21 counties, about 1.2 million people, and about 250 members of their staff are currently out because they have tested positive from COVID. They are sick or recovering. And so the strain on the system is significant, especially as over just the last month, they've seen an almost doubling in hospitalizations, and they're seeing record numbers of deaths in just the last couple of weeks. And to dig into this with me a little bit more here, I have Chief Physician Executive Dr. Clay Runnels. And Dr. Runnels, talk to me about the landscape in this area and the challenges you're facing, particularly because of some of the issues that were already going on here in this Appalachian region before COVID hit.
Well, one of the challenges that we see is the effect of comorbidities on our patients. We do have a significant number of patients that have comorbidities being things like hypertension, diabetes, obesity, COPD, coronary artery disease that exist in a patient before they become infected. And those sort of things can lead to the severest form of disease. And I think that's why we have worked so hard in this region to communicate with our communities about following guidelines with regard to masking and social distancing and those sort of things to try to slow the spread of the disease.
You also work in the ER. Can you tell me what you're seeing there right now as you're seeing this rise in cases, rise in hospitalizations in this population? And as you said, because of these comorbidities, oftentimes patients who are coming to you are coming pretty severely sick.
Yes, clearly the influx of COVID patients, particularly the sickest of that group, put a big strain on the emergency department resources. These patients require a lot of care and attention and specific care. And that puts a lot of strain on the health system and the ER in particular. However, we've been able to manage that effectively, and I can tell you that I couldn't be more proud of our staff. They're so committed and courageous, and they show up every day to care for their community and for their patients.
Dr. Runnels, thank you so much. Thank you to your team for all that they do. And Yasmin, for the last couple of days, I've been talking to so many healthcare workers who are spending this holiday week taking care of patients, and in many cases, taking care of folks they know. A lot of these communities, they are small, and they are caring for neighbors and friends, and they are there for them oftentimes in their final moments. Yasmin?
And we are so grateful for all of those frontline healthcare workers. Dasha Burns, thank you. Good to see you this afternoon. We do have some breaking news today from overseas. It involves Iran.